Spine specialist, all right. And it's going to take a second for Hey everybody, welcome in. My name is Jim Diedlow, host of Jed in the Region, as you well know, and we are going to move on with parts of our community programming initiative. This one's sponsored by Midwest Interventional Spine Specialists. Am I saying that right, Dr. Kondamuri?
That's correct, Jim. That's the name of our group.
Yeah, I got it. I've kind of hatcheted it up a couple times, and so I think I got it right there. But you know what? It's kind of cool to talk to Doctor in the middle of the day. There he is. He's in his office, and we got to zip through it because he's got patients in his waiting room. But Doctor's with Midwest Interventional Spine Specialist. Doctor, tell us where you're at and what your practice does once again.
So yes, we're a Midwest Interventional Spine Specialist, and as the name says, we treat primarily spinal conditions. We're specialists of anything to do with the spine, your low back, your neck, sciatica, herniated discs, things like that. We treat spinal stenosis or arthritis of the spine. And we're in Munster, Indiana, and we're also in Chesterton, Indiana, as well as in Dyer and Hobart. And I'm here with my partners, Dr. Desari, Dr. Shetty, Dr. Gupta, Dr. Kondamuri here with our nurse practitioners, and we treat chronic pain on a daily basis. We've been here for like 20 plus years.
All right, so you said Munster, Chesterton, Dyer, and what was the last one?
And Hobart.
Okay, I don't know where that one is. I think I know where the other three are. And the one in Munster is on Calumet Avenue, correct?
Yes, right on Calumet Avenue, right next to the hospital, kitty corner from Community Hospital.
Yeah, so just to get off topic, tell us how fun it is to drive south on Calumet Avenue through the construction zone.
Gosh, absolutely not fun. It is just, I don't live very far away. I just live in Dyer, but it takes sometimes 15, 20 minutes to get there.
Yeah, if anybody's watching this later, it's probably still going to be under construction, but it is a massive project to go underneath some railroad tracks, and it is scheduled to last about a year and a half, 2 years, and it is in the middle of summer as we're sitting here in late June of 2020. And it is no fun at all. Even on a Sunday morning, it can actually get problematic. But right now, if I were to drive over there, it would be tough because in that area. Doctor, we are in the summer months, but perhaps more importantly, we're coming off of lockdown on the coronavirus lockdown. You and I talked a lot during the lockdown on well-being, wellness. We talked about pain and maybe some things getting pushed back that people weren't able to get in and so forth. Now we're starting to get into some middle stages of coming out of the lockdown. What are you seeing? What do you want to tell people?
Well, I want to tell people to get outside. I think it's important to get out there. And I hear more and more that while half the population is super excited about getting outside and enjoying the fresh air and just getting out of their homes, there are still some people who are really scared and they're afraid to go out. They're afraid that they're going to catch COVID-19. And I try to encourage them, wear your mask and go outside. You need to breathe that fresh air, and outside is a safe place to be. The wind is probably blowing. Any virus in the air is going to get diluted by the air. And if you stay away from people, you're really, really safe. I mean, you can be outside and you need to get outside. The concerns, though, are, where are we with COVID-19? We, as more and more people get out and if people start congregating a little bit, then there's going to be a risk of maybe some more transmission. We're going to have more people and more cases. And more cases mean possibly very sick patients. That's a concern. Right now, it's really good. I mean, in Indiana and Illinois, Chicagoland area, the cases have come down quite a bit, which is really nice.
If you guys got a question for Dr. Kondamuri, we can actually take a phone call right now at 219-845-1100. You have any question about pain or coming out of coronavirus or wellness in general, doctor will take that. Doctor, let's go more specific on pain. Perhaps during the lockdown and when people just weren't seeing as many patients, if any at all, it's for a while, some of your folks had to have, I'm sure, just not come out even though they were in pain. Now that they're coming out and you're saying, we had to move the time around here, you're a lot busier. What are you seeing from people? What did they put on the back burner? what would you say, hey, don't put this on the back burner? We've seen some people who've done this, and maybe if you do have this, we do have to address it. Yeah. So
Great observation. Great observation, Jim. I mean, the thing is, people are putting everything on the back burner. I mean, if people are putting their heart disease, their heart conditions, like if they're having chest pain and they're putting that on the back burner, not going to the hospital, I mean, that is pretty dangerous, and that is happening. So everything else beyond that, which is perhaps less immediately dangerous, is happening, and it is problematic. I mean, people are just afraid to go to were afraid to go to their doctor. It's changing a lot now, but they were afraid to get into their doctor's office. And even if they went to the doctor's office, that was fine. They were very afraid to go to the hospital. They didn't want to go to the emergency room. They don't want to be in the hospital because they know the hospitals where COVID-19 is swimming around in the air and in the ventilation system. They just didn't want to be there. Obviously, if you're sick, you don't want to be where sick people are unless you have to be there, because that's where you're going to get sick more likely, because it's all there. So that's a concern. But I want to really address that patients in the general public shouldn't live in fear, because you remember those heat maps we used to see, where the heat maps would have a big red circle which tells you there's a lot of COVID-19 in this area, or a small red dot which means there's a moderate or medium amount of COVID-19. Well, people see those maps and they think, God, I mean, there's lots of COVID-19 in Chicago and in Northwest Indiana, and we're scared to go out. But we have to remember that it is not, COVID-19 is not everywhere. The virus is not everywhere. People should not be afraid to go out. They should take precautions. They should wear their mask, and they should socially distance. Keep 6 to 10 feet away from people, and you're likely going to be safe. And the other thing, Jim, is even if you become infected, doesn't mean you're going to get sick. I mean, a lot of people are infected, but they have no real symptoms. And there's a lot of talk about, I don't want to go outside, or I want to stay away from people because I don't want to catch COVID-19. Well, that's one problem indeed. We don't want to get infected. But more importantly, when you get infected, what do? You want to make sure you are in the best position to not succumb to the disease. Or if you do have the disease, it's a very mild disease, respiratory symptoms, shortness of breath, for example. But it's not severe disease where you're admitted in the hospital, or you've got a ventilator and you're not intubated. So we don't talk much about what to do to prevent getting sick when you do get the illness. And those are things I think that people need to be thinking about and trying to stay healthy.
All right, so we got a lot on there, but I got to go back to the first thing that you talked about. And that's a 4-letter word that starts with F. It's called fear. And the fear is something I see on the radio every day. And I'm not going to do the show today, but I do a show in the afternoon. And I understand the uncertainty that people live under. And one of those is that it seems like wear a mask, don't wear a mask. There is going to be a vaccine, there isn't going to be a vaccine. Get out in the sun. Vitamin D has a study where vitamin D helps against COVID. You can get it on a surface, you can't get it on a surface. I mean, there's probably been at least a half a dozen big shifts in the information that has come down to the average person. What are maybe one or two of the things that you can say that most people agree on that the average person can take away and maybe just take that level of fear from a 7 to a 6?
Yeah, so the one thing we do know, Jim, is we don't know everything about this illness. And as you said, whatever we seem to know today changes a week from today or a month from today. So it's just a lot of uncertainty there. The thing that we do know, though, is that fear is fear. Fear is what? False expectations appearing real, right? That is what the word fear means. You expect something, you think it's real, but it's false. It's really not that. It's not as bad as you think it is. So what we know is that if you are sick, if you're somebody who has a pre-morbid condition like diabetes, especially uncontrolled diabetes, or heart disease, or pre-existing pulmonary disease like asthma or emphysema, and if you get COVID-19, well, you're going to get pretty sick. It's very likely or possible you're going to get sick. So you want to take the most precautions. If you're younger, in your 40s, 30s, 20s, even 50s, and you're healthy, take precautions, but you don't have to fear everything. I mean, wearing a mask is a very appropriate thing to do. I was at I was at a place having dinner last weekend at somewhere. I won't say where. And there was a wedding going on. And this is just a week ago. And there's a wedding going on, and there were probably 100 people there, all congregated into two big rooms. And I was shocked that nobody was wearing a mask. And nobody wearing a mask in a situation like that, you are putting yourself at risk because you're probably going to contract the disease. And more importantly, and more seriously, you're going to give it to somebody else who may be at risk, like that person who has diabetes or hypertension or emphysema. If you give it to those people, then they're going to have potentially a bad course of disease. Or some elderly person who's just really a grandparent at home might get it from you because you were at that wedding. So I just really, it does upset me when I see people in large groups who are next to each other not wearing a mask. That's the simplest thing to do. Wear a mask. And if you can, stay away. The third thing is, if you are outside, and as you mentioned, the virus is going to be on surfaces, just don't touch your face. Don't touch your eyes or touch your nose or touch your mouth until you wash your hands when you get back in. But those are the three simple precautions. It's not that complicated.
I've seen that over and over, and I guess they're getting a little more specific in the mainstream media about exactly what they know. But as far as I understand it, it has to at some point get into your respiratory system. Is that correct?
Correct.
And it can do that. Go ahead.
Yeah, so two things have to happen, Jim. One is the virus, we talk about a term called the viral load. So you've got these individual COVID-19 virus particles that are maybe in the air, and you breathe them in. Let's just, to make it simple, let's say you breathe in one or two of those particles. Now compare that to breathing in 100,000 particles. If you breathe in 100,000 times the one, then you have a larger load that you're taking into your system. So if the load is larger, you have a higher risk of contracting the illness. And the way you're going to have a larger load is if somebody sneezes on you, or if somebody coughs on you, or if somebody talks loudly in front of you, like in a bar. That's why we shouldn't be in bars right now. And I don't know what's going to happen going forward, but when we're in the midst of all of this, and there are a lot of cases, if you're crowded into a bar, for example, then you're going to have lots of people you're going to have loud music going on, so you can't hear each other. So you're going to be yelling at each other to talk, to hear the person next to you. And when you yell, you really expel those virus particles out of your mouth into the person you're talking to. So if you have COVID-19, you're going to give it to that person. Even singing loudly is a problem. So if you have a large load that gets into your system, that's the first thing you need to get potentially sick. So once the load enters into your respiratory system, then those virus particles have to replicate. They have to attach onto different cells in your lungs, and they have to replicate. When they replicate, that means your 1,000 or 100,000 particles now become much more, and they get into your DNA, and they get into the actual cells, and you now have changes that happen in the respiratory system or the cardiac system that leads to very severe illness. So to repeat that, one, you need a large viral load, which happens if you're in front of if you're exposing yourself for a long time in front of somebody without a mask, and if that person is shedding a lot of particles onto you. And then once it's in you, your body has to be in a situation where it's not healthy enough, and the virus replicates and you get the disease. In a healthy person, that doesn't happen generally. In an unhealthy person or a person who has some other illnesses, that's going to happen more likely.
We're talking to Dr. Sean Kondamuri of Midwest Interventional Spine Specialist, and is essentially pain doctor, and I think that's his email. But we have been able to branch out considerably during COVID-19. I think we started right before COVID-19 together, and now we kind of followed it all along. Doctor, to get back to that second part about your body not healthy enough, I got to ask you once again to repeat your theory on wellness. There's enough people watching and listening, they may not have heard it, and how you, I guess to some extent, how you might prepare your body just in case. How does that sound?
So I think I know where you're getting with that, and I'm going to say if you stay healthy now and prevent and keep your body healthy to succumb to COVID-19, all this is over, you're going to be that much everything else. And the way you do that is you prepare. you prepare for the COVID marathon. So it's sort of like a marathon. Get yourself healthy now, don't get COVID, but you're also healthy after COVID-19 is over. And I think what you're kind of referring to, Jim, is what I talked to you about a while ago, and that was those 4 simple measures that if you kind of implement them in your life, you're probably going to stay fairly healthy. And that is eat less, move more, stress less, and love more. And if you do these things in the right way, you will be able to survive the COVID marathon.
All right, just so you want to, if you look, if you're, I like little phrases and little sentences to kind of keep you updated in your own mind. And it's kind of hard. I don't really remember this, but I just figured out a way. Eat, move, stress, love. Eat, move, stress, love. So it would be eat less, move more, stress less, love more. And there it is.
And also, Jim, it's a less, a more, a less, a more in that order.
Yes, yes.
So eat less, move more, stress less, love more.
Yeah, if I can remember these 4 words, I can figure out which one you need to do less and more. Move, you don't want to move less, you want to move more. Eat,
Right.
Move, stress, love. 219-845-1100. Let's talk to the doctor. Hey, you're on the air. What's going on?
Hi, I was listening and read some research that the COVID-19 is in fact a bacteria and not a virus, and wanted to hear what your guest has to say about that. And also, with the months that we've been under the quarantine, the levels of stress that so many individuals have taken on, how do you see that as contributing to some of the, I guess, becoming a comorbid part of the illness as individuals endure more stress?
Give us an example of the stress you're talking about.
Well, for example, there are individuals who just from being in, not being able to go out, having to wear a mask, having to change their lifestyle when they've been used to living a certain way. And in one recent incident that happened in the region was a young man who was killed in the Munster Hospital in the psychiatric ward. And I'm wondering if the officers were under a level of stress, not to mention the gentleman had, they think that he had some illness because he was a football player. He had mentioned he had suffered a lot of stress, and that was the reason why his family decided to admit him because of his behavior. And that having to do with the pandemic, the recent riots, it all kind of took its toll, compiling and adding on to the fact that we now have this virus that we've got to live with and change our lives for.
Excellent. Thank you. Doctor, I was going to ask you about this. I went to a party on Saturday, and not a party, but just like a backyard thing in the neighborhood, and heard a story about a woman who was going along fine, and then all of a sudden COVID hit, and, is just at a level of anxiety where, needing medication and stuff. And I've heard a number of these stories. What do you say?
It absolutely has something to do with that. For the lady who's called us up right now had a couple of questions.
Yeah,
First thing she
bacteria.
said,
Let's do bacteria first.
yeah. I have not heard that. I have not heard that that's in any, in any scholarly way that this is really a bacteria. I think that until proven otherwise, this is a virus that we're dealing with. And the virus, because of the way it seems to replicate, one would think it's a virus, but it really doesn't matter. It's something foreign to your body that is now causing an illness. That's whether you call it a bacteria or virus, doesn't really matter. I'm going to stick with the fact that it probably is a virus. With regards to her question about stress, stress is absolutely something you have to control. We talked a little bit about the viral load. We talked about how the body reacts to it and how it replicates in the body. There's something called a cytokine storm. And these cytokines, when they act on your body, they cause a lot of the inflammation and illness that we suffer from. Stress raises those cytokines. Inactivity raises those cytokines. So it is a fact that if you relax yourself with meditation or some other means to reduce your stress, you are going to reduce the cytokine levels in your body, and you have potentially less danger when it comes to contracting an illness like this.
Yeah, I see it more and more, man. It's just on the air. I see the uncertainty, and it seems as the longer we go, in the beginning, it was almost as if people got punched in the face and were kind of dazed and were kind of dealing with it for a couple of months. And now it's setting in like, hey, dude, this isn't going away. Talk about the long-term effects of elevated levels of stress.
Yeah, so I mean, elevated levels of stress have a huge impact, a huge negative impact on your body. As you said, this is not really going away, and it's not just that so we're getting exposed to some sort of stress, the stress of COVID-19, the stress of the media, the stress of all the onslaught of information that comes at us, and all the fear that we have. So it's one thing that a body gets exposed to stress, but what matters is really how you deal with the stress. So if you let that particular stressful event or stressful condition affect you negatively, well, you're going to have negative consequences. So I just want to say it is important to identify what's stressing you. I mean, verbally identify it. Talk to your spouse or family member, or write it down. Just get it out. Somehow get it out, because we belong to a kind of a society in which, especially men, they tend to hold everything in. So men especially will feel a lot of stress at work, or with their significant other, or who knows what, and they never talk about it, and that just builds up inside of you, and it causes a lot of effects to your cardiovascular system and your central nervous system that end up becoming negative. So you want to get it out first. Get it, identify it, and at least get it out somehow. And if you're afraid to talk to somebody, at least write it down. Just write it down. Journal. The reason I really push journaling is because when you journal, that's just you and your notebook. Nobody else has to see that if you don't want them to. But then when you're writing it down, it's almost like you're talking to somebody. You're getting those words out onto paper, and then you go back and you read that paper, and you see that maybe what was going on wasn't really that bad, or it really wasn't as serious as you thought it was, because everything just sort of gets better somehow.
Hey, he's Dr. Kondamuri. Doctor, we got another phone call. We're going to try to squeeze this in if you're okay with that.
Sure.
Yeah, let's go to this, 219-845-1100. Hey, you're on the air. What's up?
Well, I have a couple of articles I'd like to bounce off the doctor, but at a layman's point of view, I think Americans have just got to grow up and accept that, we live with car accidents. The seasonal flu kills tens of thousands of people. We've got cancer. We've got strokes. We've got heart attacks. I mean, this is just something we're going to have to learn to live with. It'll get better as they put together some inoculations and treatments and so forth. But it's going to take. We're going to be living with this for a while. They're all screaming about second wave. I think we're going to have a third and a fourth wave. So get real. Any case, there was a very good article in the Times, like a Thursday or Friday of last week, dealing with the association of symptoms from COVID-19 depending on your blood type. So there's 4 blood types. A, you're at highest risk for symptoms, and if you're O, you're least at risk for symptoms. And this was a study done in Europe. And another article that was really quite good is in the latest edition of the Week magazine. They had a piece about the Navy aircraft carrier Theodore Roosevelt. As it turns out, a former squadron mate of mine was the commanding officer of that carrier at one time. But in any case, the article shows some information about the impact on the COVID-19 virus. You may remember that the commanding officer of that ship got in a lot of trouble with the Navy because he asked for help in terms of dealing with the thing. But the studies they did showed that of 4,900 people aboard the carrier, 25% were actually infected. Very few actually had symptoms. It was either no symptoms or very mild symptoms. Of that 25%, 10 had to be hospitalized. 1 actually died. Now, they looked at the impact of wearing a mask, social distancing, staying away from large groups of people. And what they found was that if you wore a mask, you were less likely to be infected than if you didn't wear a mask. If you exercised social distancing, you were less at risk of being infected than if you didn't. And of course, if you stayed away from large groups of people, that was very good too. So these are all practical things. I personally have exercised from almost the very beginning, and I'm at high risk on 2 factors. One,
all right. Well, we're gonna get up to the clock, but you got a lot in there. Let me follow up on that. Thank you so much. Gotcha.
Yep.
All right, let's take this first part. The blood type thing, I've heard that too. Have you seen anything on that? It's kind of brand new in the news right now.
I have heard that, Jim, but I don't know how much data there is to really to suggest if that's really true. It may be true. My blood type is type A, and I would be at the highest risk in that case. But whether I was type A or type O, I have to still maintain the same precautions. Your caller was exactly on target when he said, wear the mask, maintain social distancing, and stay away from large congregations of people. And he mentioned the aircraft here, the Teddy Roosevelt, USS Teddy Roosevelt. And you got to remember, they were all together on one ship. That was sort of a controlled environment. They never went out. They didn't meet families. They were all on that boat. 25% of them got infected by the virus, and very, very few of them actually got sick. But remember, that's a very controlled environment. Everybody on that ship is probably under the age of 25, the vast majority of them. They're all seamen, and they're young people. And some of the admirals and the skipper and those guys, they might be older, but the vast majority of them on the boat were very young and probably very healthy. And as he mentioned, they exercise. So I mentioned earlier, we want to really get our bodies in the best shape possible so that if we contract COVID-19, we won't have a serious illness. And that's through everything we talked about. That's through diet, that's through exercise, that's through mental conditioning. You have to actually cognitive conditioning, where you tell yourself positive things. You don't let yourself get negative and pessimistic. That's how you're going to get sick, whether it's COVID-19 or anything. He's Dr.
Sean Kondamuri, and if you want to watch this, he had all sorts of excellent information, kind of boiling down some rather complex topics. And all you got to do is go on to Facebook, our WJOB network Facebook, or you can go to our WJOB network and you'll be able to see it on the app, on Amazon, Roku, your phone, wherever it might be. Doctor, there's so much to get to. We'll do it again next time.
Sounds good, Jim. Thank you very much.
Thank you so much. Excellent stuff there. And let me wait to get over here and end this. I'm going to end Doctor. He's got to go back to his patient. See you later, Doctor. And then I will